Your dog walks up to greet you at the door, tail wagging, same as always. He eats his breakfast. He follows you around the kitchen while you make coffee. Everything looks completely normal. And that's exactly the problem, because dogs are hardwired to hide when something's wrong. It's an instinct left over from thousands of years of evolution, back when looking weak or sick made you a target. So while you're watching for limping, whining, or an obvious change in behavior, the truth is that by the time a dog is showing those clear signs, whatever's going on inside has often been building for months, sometimes years. Today we're going through 10 health issues that hide in plain sight in senior dogs, the kind of things that don't announce themselves with a dramatic symptom, but instead show up as a slightly slower walk, a little extra water in the bowl, or a nap that runs a few minutes longer than it used to. If you've got a dog 7 years or older, or if you're getting close to that mark, stick with me through all 10. Because a couple of these are going to change the way you look at your dog's daily habits. Let's start with the one that flies under the radar more than almost any other, and that's kidney disease. Dogs' kidneys are workhorses. The tricky part is that a dog's kidneys can lose a significant portion of their function, we're talking sometimes over half, before you see any outward sign at all. The tricky part is that a dog's kidneys can lose a significant portion of their function, we're talking sometimes over half, before you see any outward sign at all. The kidneys are so good at compensating that your dog can look completely fine on the outside while the damage is already substantial on the inside. The clues, when they do show up, are subtle. Maybe your dog starts drinking more water than usual. Maybe there are more trips outside to pee or bigger puddles when they go. Maybe you notice slightly less interest in food or breath that smells a little different than it used to. None of these scream emergency, which is exactly why so many owners miss them. The only real way to catch kidney disease early is through routine blood work, specifically a blood chemistry panel and a urinalysis. And this is why vets push so hard for annual or even twice yearly senior wellness exams. The only real way to catch kidney disease early is through routine blood work and urinalysis. This is why vets push so hard for annual senior wellness exams. Next up is arthritis, and I want to be clear about something here because this is probably the most underestimated issue on this entire list. Most owners think of arthritis as something you'll obviously notice, a dog limping around on 3 legs. But that's actually the late stage. Arthritis in dogs develops gradually, and dogs adapt to pain gradually right alongside it. Your dog doesn't wake up one day unable to walk. Instead, over months, they start taking the stairs a little slower. They hesitate before jumping into the car. They shift their weight differently when they stand up from lying down. They might sleep a little more, not because they're tired, but because moving simply feels better when they're not doing it. The single biggest mistake owners make is chalking all of this up to just getting older, as if slowing down is some kind of unavoidable law of nature rather than a symptom with a name and, often, a treatment. One of the best things you can actually do is track your dog's activity over time instead of relying on your memory. Time the same walk once a month. If a walk that used to take 20 minutes now takes 30, or your dog is covering noticeably less ground in that same 20 minutes, that's data and it's telling you something. Arthritis is manageable with joint supplements, anti-inflammatory medications, weight management, and in some cases physical therapy, but only if you catch it instead of writing it off as old age. Then there's dental disease, and this one deserves way more attention than it usually gets, because most people think of it purely as a cosmetic issue. Bad breath, maybe some tartar, no big deal. In reality, dental disease in dogs is a slow-moving infection that sits right at the gum line, and by the time a dog is showing obvious signs like drooling, pawing at the mouth, or refusing to eat, the disease has often progressed to the point of loose teeth, painful abscesses, or bone loss in the jaw. Here's the part that really matters. Bacteria from infected gums doesn't just stay in the mouth. It can enter the bloodstream and travel to the heart, the liver, and the kidneys, contributing to disease in organs that seem completely unrelated to your dog's teeth. And dogs will keep eating through significant dental pain because a missed meal in the wild means starvation, so the instinct to keep eating overrides the pain signal. The giveaway signs to watch for are bad breath that's noticeably worse than usual, a preference for softer food, chewing on one side of the mouth, or tartar buildup that looks heavier than it did a year ago. Annual dental checks and cleanings under anesthesia when your vet recommends them are one of the most overlooked ways to add healthy years to a senior dog's life. Heart disease is next, and this is a big one because dogs can compensate for a failing heart for a remarkably long time before anything looks wrong to the naked eye. The most common form in senior dogs is a condition where a heart valve starts leaking, and it usually starts as a very faint murmur, something only a vet with a stethoscope is going to pick up during a routine exam. There's no way you're catching that at home. What you might eventually notice, and only after real strain is built up, is a cough that shows up mostly at night or after lying down, faster breathing even at rest, tiring out on walks that used to be easy, or a general reluctance to get up and move. The unsettling thing about heart disease is that dogs will often still wag their tail, still greet you at the door, still seem like themselves, right up until the point where the heart simply can't keep compensating anymore. This is another one where a yearly physical exam matters enormously, because a vet listening to your dog's chest for 30 seconds can catch a murmur years before you'd ever notice a symptom, and early intervention with medication can significantly slow the progression. Now let's talk about something that's harder to define but just as real, and that's cognitive dysfunction, which is essentially the canine version of dementia. This one is sneaky, because the signs look less like a medical problem and more like a personality change. And personality changes are easy to explain away. Maybe your dog starts staring blankly at walls or into corners. Maybe they seem confused about where they are, even in your own house. Maybe their sleep schedule flips, restless and pacing at night, sleeping heavily during the day. Maybe house training that was rock solid for a decade suddenly falls apart, not because of a medical bladder issue, but because the dog genuinely forgets. Maybe they seem less interested in interacting with you, or they get anxious in situations that never used to bother them. It's incredibly easy to write all of this off as your dog just getting older and grumpier. But cognitive dysfunction is an actual diagnosable condition, and there are dietary changes, supplements, and medications that can slow its progression and meaningfully improve quality of life. The key is recognizing that a behavior change in an older dog is a symptom, not just a personality shift, and bringing it up with your vet instead of assuming there's nothing to be done. Cancer is the one most people fear the most, and unfortunately it's also one of the hardest to catch early because it can grow silently for a long time depending on the type. In the United States, roughly half of dogs over the age of 10 will develop some form of cancer, and it's the leading cause of death in dogs past the age of 2. What makes it especially tricky is that we don't have the same robust early detection blood tests for dogs that exist for humans, although that's an area of veterinary medicine that's advancing quickly. The things worth watching for include any new lump or bump, especially one that's growing or changing shape, unexplained weight loss even though your dog is eating normally, wounds that won't heal, swelling anywhere on the body, or a general drop in energy that doesn't have an obvious cause. Not every lump is cancer, and plenty turn out to be harmless fatty growths, but the rule of thumb vets recommend is simple. Any new lump gets checked every single time rather than being monitored from a distance for months. Regular physical exams, where a vet is running their hands over your dog's entire body, catch things that owners often miss simply because they're not doing a systematic check the way a professional does. Next is hypothyroidism, which is one of the most common hormonal issues in senior dogs and one of the easiest to miss because its symptoms look exactly like normal aging. The thyroid gland controls metabolism, and when it's underperforming, dogs tend to gain weight without eating more. Their energy drops, their coat gets thinner or duller, they may lose hair in patches, and their skin can become dry or flaky. Some dogs seem to feel the cold more than they used to. All of this reads as just your dog getting older and a bit lazier, when in reality it's a hormonal imbalance that shows up clearly on a simple blood test and is very treatable with a daily medication. The frustrating part is how often this gets missed for months or years because the symptoms are so gradual and so easy to attribute to age. If your senior dog has put on weight despite no change in diet or activity, or their coat has lost its shine, it's worth specifically asking your vet to check thyroid levels rather than assuming it's inevitable. Vision loss is another one that sneaks up because dogs compensate for it so well. A dog who's slowly losing their eyesight, often due to cataracts or age-related changes in the eye, will typically keep navigating a familiar home just fine, because they've essentially memorized the layout through smell, hearing, and muscle memory. The tell usually isn't clumsiness at home. It's hesitation in unfamiliar places, bumping into furniture that's been moved, reluctance to go downstairs in dim lighting, or a new nervousness in the dark. You might also notice the eyes themselves looking cloudy or slightly bluish, which is often a normal age-related change called lenticular sclerosis, but can sometimes indicate cataracts that are worth having evaluated. Because dogs adapt so well, vision loss can progress a long way before an owner notices anything's different, which is exactly why it belongs on this list. Hearing loss follows a similar pattern. It tends to happen so gradually that dogs adjust in real time, and owners often mistake it for the dog becoming stubborn or ignoring commands. If your dog used to come running the second you opened a bag of treats and now seems oblivious unless they can see you, that's worth paying attention to. A simple way to check at home is to rustle a treat bag or clap from a distance when your dog isn't looking at you and see whether they respond. Just keep in mind that some dogs develop a kind of selective hearing regardless of age, so it's not a perfect test, but a consistent lack of response across different sounds and situations is a real signal worth mentioning to your vet. And finally, incontinence, which tends to be more common in senior female dogs but can affect any dog as they age. This isn't about a dog having an accident because they were held too long. It's about a genuine loss of bladder control, often caused by weakening of the muscles that keep the bladder closed, sometimes tied to cognitive decline that affects house training memory, and sometimes caused by an underlying issue like a urinary tract infection. The signs to watch for are damp spots where your dog has been lying, urine dribbling without your dog seeming to notice, straining or difficulty producing a normal stream, or house training slipping after years of being reliable. It's easy to feel frustrated when a well-trained senior dog suddenly starts having accidents, but this is very rarely a behavioral choice. It's a physical or neurological change, and there are medications and management strategies that can help significantly once the underlying cause is identified. So here's the thread that runs through every single one of these. Dogs are built to mask discomfort, and the changes that matter most rarely show up as something dramatic. They show up as a slightly shorter walk, a little more water in the bowl, a nap that runs a few minutes longer, a coat that's lost its shine. None of that looks like an emergency in the moment, which is exactly why it's so easy to miss. The single best tool you have isn't a symptom checklist. It's your own memory of what normal looks like for your specific dog, and a willingness to track small changes over weeks and months instead of dismissing them individually. Pair that with a real senior wellness exam at least once a year, ideally with blood work, because a vet's hands, stethoscope, and lab tests can catch things years before your eyes ever could. If anything in this video sounded familiar, even a little, it's worth a call to your vet rather than waiting to see if it gets more obvious. Catching these things early isn't just about adding years to your dog's life, it's about keeping those years comfortable. If this was helpful, hit subscribe for more content like this, and let me know in the comments which one of these surprised you the most.